Hello, my name is Daryl Gordon. I'm Vice President of Marketing at MediKeeper, and thank you for joining us today. This session is going to be recorded and it will be available afterwards on the MediKeeper website, where you'll find copies of all of our other webinars available. And we do have a large group with us today, so we're going to again use the Zoom chat functionality. You know how it works. Click on the button, submit a question, and we're going to come back and answer all of your questions at the end of the session. And if we miss them, we promise to get back with you afterwards. We are scheduled to run 25 minutes today, and our topic is Wellness Trends 2022. So for the last 5 years, MediKeeper has had a look at the trends that we believe will play a major role in employee health and wellness, because understanding these trends can really help organizations better plan for 2022 and beyond. So to walk us through the trends today, we have Dr. Tyler Amell, who's the Chief Health and Strategy Officer of MediKeeper, and he's going to be with us on the call and walk us through these. And so Tyler, welcome, and we're looking forward to your thoughts on all of these trends.
Thank you very much, Daryl, and good morning, everyone. We really appreciate you taking time out of your busy schedules to join us here this morning. This is an exciting topic from our perspective. As Daryl mentioned, we've been spending a lot of time doing this over the past few years, and this year, our level of excitement is pretty high, given the significant implications around employee health, productivity, and wellness that we've experienced during the pandemic, and of course, as we move into these next phases, this does have implications for how and where we work and where we address these sort of things from this perspective. So with that being said, from an affiliation and disclosure perspective, as Daryl mentioned, I'm the Chief Health and Strategy Officer at MediKeeper. I wear a few other hats. I sit on the board of the National Wellness Institute, as well as the Work Wellness Institute. And I am on faculty at Pacific Coast University for Workplace Health Sciences. So that's a university dedicated to training workplace health professionals. So from primary prevention, so well-being programs, occupational health programs, right on through to work disability management, work disability prevention. My blog is worksitedoc.com. Feel free to look at that. There's a lot of evidence-based research summaries on a variety of different topics related to workplace health. And of course, feel free to reach out to me on LinkedIn. Always great to hear from people and have some meaningful conversations there. Now, when it comes to MediKeeper's webinars, what you see on the screen here is just an example of the past couple. So these are available on the MediKeeper website as far as the webinars, and associated white papers are in the process of being completed. So if we think back to late September, we did focus on mental health and diet. I also did a session on work disability prevention for the International Foundation of Employee Benefit Plans. And that was followed up by a conference presentation at the Art and Science of Health Promotion, which is an IFEBP event, where I spoke on changes in health risk during the pandemic, and of course, what those implications are for the future of workplace wellness. Now, the article that presentation is based was just published in the American Journal of Health Promotion. So if you want a copy of that, feel free to reach out on LinkedIn, and I can get you a copy of that for sure. In October, we did continue the conversation around the relationship between what we eat and mental health and brain health and resilience. So very much looking to tie those elements together from a stress, depression, anxiety sort of perspectives, and looping that back into the concept of food as medicine. Then we talked a little bit about wellness education, training competencies with Chuck Gillespie from the National Wellness Institute, the CEO. And then I actually gave an NWI webinar on technology-driven wellness solutions for 2022. And there are some similarities between that discussion and what we're going to talk about today. Wrapped it up with a session on workplace vaccination policies a little over a week ago. Very well attended, very well received, lots of information there. And of course, today is our last webinar session in the MediKeeper series. This one is very much focused in on, what's coming around the corner in 2022 and what's been happening as of late, and what that means for strategies targeted at improving workplace health and productivity solutions. Now, it's hard to underestimate really the impact of the SARS-CoV-2 virus and COVID-19 disease, and the impact it's had on how and where we work, and all things related to health and productivity. When you think about traditional focuses of occupational health and workplace health and even well-being strategies are typically on chronic disease. So musculoskeletal disorders, stress, anxiety, depression from a brain health perspective, of course, type 2 diabetes, cardiovascular disease, the list goes on. We tend not to focus on communicable diseases. And of course, COVID-19 disease is very much a communicable disease. So it's usually not on the radar, but it has had such an accelerating effect on a lot of things that we do from an integrated health perspective. That, when we look into the crystal ball to see what's going to happen in 2022, this is definitely not going away. In fact, it may get a little worse here in the near term as we deal with plenty of converging issues around this. So we think that this is definitely something that to keep in the back of your mind as you look to plan your workplace health strategies. I'm sort of reframing the conversation to living with COVID risk. There still is threatened collapse of certain healthcare systems in certain areas. And over time, this virus, if it follows the same pattern of 100 years ago with the Spanish influenza, the virus does tend or may get less serious over time, which may increase its virulence in the short-term period or transmissibility, but hopefully it will cause less severe disease and less severe risk, so that then it becomes a background risk sort of strategy. Most of the influenza strains that we deal with today, and there's about 300 of them, are in fact ancestors of the Spanish influenza from 100 years ago. Now, influenza is still very serious, don't get me wrong on that, and COVID is significantly more serious than that. But hopefully over time here in the near term, we'll be able to get a better understanding on that. Of course, we do have vaccine and testing mandates currently being challenged in the courts. We'll see where things are going to lie from that perspective. But if we want to move forward through the pandemic, we need to get as many people vaccinated as possible, and that is not going to change here in the near term. It's still one of the best defenses, but it also is one tool in the toolbox, and we do have various other approaches that can make sense to use as well. And then there's the concept of returning to places of work or not. If we look at the Great Resignation and people's desire to continue to work from home for the 80 million or so people who've been doing that, of course, this is outside of the people who were deemed not essential. So, outside of healthcare, outside of manufacturing in certain areas where people had a choice, were fortunate enough to have a choice. A lot of people do want to stay there and continue working from home, which means that employers have to have a different strategy in place to help protect the health of those individuals as well, because the risk profile is a little bit different. And so having these elements all come into play would definitely be something to keep on the radar screen as we move into 2022. Now, from a viral evolution perspective, or something that's called antigenic shift or different variant expression, we do have the Omicron variant out in the community right now. It has been shown to be sustaining community-based transmission, so outside of travel. Hopefully, Omicron variant will displace the Delta variant. The Delta variant appears to be more severe from a disease perspective, leads to an awful lot more deaths than Omicron, at least at this point. Our understanding of this variant is changing, and so that does have an impact as to how things are going to play out here in the near term as we move into 2022. We can't just will this thing away. We have to have a concerted effort in order to move into the next phases of the pandemic. Now, unfortunately, when you have a large pool of unvaccinated people, that's really where viral evolution can take place. And in fact, that's exactly what happened with Omicron. Omicron has a lot more mutations than some of the other variants out there, which is one of the reasons why we're quite worried about it. So it may be a scenario whereby more people get infected, but less people die from it, which would be quite beneficial, given the fact that we have about 800,000 U.S. citizens that have passed away to date, about 5 million globally. So those are some big numbers there, and anything we can do to help stem that tide, particularly from a workplace health perspective, is going to be quite meaningful. Now, with that being said, from the pandemic's perspective, there has been a significant amount of understanding and observances around brain health profiling or mental health profiling. Right now, we're sitting at about 2 in 10 U.S. citizens impacted by substance use. This has been an increase during the pandemic. we have about 4 in 10 suffering from anxiety or depression. So that's 40% of the population. These are some big numbers. Now, these numbers were increasing prior to the pandemic, but they've accelerated rather significantly during the pandemic. Now, globally speaking, we have about 7 in 10 people struggling or suffering from a brain health perspective. So this is quite worrisome, especially for multinational employers who have employees outside of the US, where, you know, we only have 40%, as sad as that is, but not nearly as bad as what we're seeing globally in this sense. You know, one of the scarier statistics right now is 1 in 10 people reporting suicidal ideation during the pandemic. So again, this absolutely is something that well-being strategies and workplace health solutions need to be targeting from a brain health perspective, from a resiliency perspective, from a coping perspective. You know, substance use for coping is not something that can be sustainable. And so that's definitely not a path that we want employees to go down. And so having robust solutions in place to help people mitigate that risk is definitely something that we're going to continue to see in 2022 and beyond, really. Now, from a depression perspective, pardon me, we know that depression cases were increasing prior to the pandemic. Now they're around 3-fold higher than they were prior to the pandemic. And we know what the risk profile looks like. Lower income, having less in savings than those who have more, exposure to more stressors, you know, essential workers, those healthcare workers, definitely targeted populations here with regards to how they've been faring during the pandemic. And so our strategies very much need to be focused in on that. Now, these data are from Gallup. These were released a couple of days ago. This is the negative experience index globally. So we're sitting at the highest point it's actually been since 2006, whenever Gallup first introduced this. Lots of different reasons for this. The pandemic has, of course, accelerated it, but it's not the only reason. You know, climate change is on most people's minds these days. You know, we think of flooding, we think of fires, we think of severe things that are happening well beyond our control as an individual. And so realizing that it's not just about the pandemic when it comes to stress, anxiety, and depression, and helping people identify perhaps things that they can do locally for their own mental health in relation to a changing world and a changing climate. But that's not all the story. You know, there is a rise in authoritarianism leading to significant stress. There is a decline in democracy, not just internationally, but right here in the US as well. So these are things that are coming out in people's minds in this respect. And again, it's not just limited to the pandemic, and it's not just limited to brain health. These are impacting physical health as well. In fact, there is a good summary of the current climate in the world from a variety of perspectives and the health implications for that, and they are rather substantial. But if there is a silver lining in all this, is that stigma is decreasing in the US. So people are more willing to admit that perhaps they need some help and are reaching out for help. So as sad as it is, you know, that is one bright spot in that respect. Now, the next item is diversity, equity, and inclusion. You know, we've really seen a drive in this over the past couple of years. In fact, just prior to the pandemic, I was actually putting together a conference on the relationship between diversity, equity, inclusion, and health. But unfortunately, that was shelved because we couldn't get people together, of course. Now, you know, this is something that approaches to workplace health really have to incorporate into their approach in 2022. You know, it's marginalized populations or populations that have been marginalized historically. We need to figure out a way to communicate with these subpopulations and really make things a little bit different than what we've done in the past. And so, you know, we've seen communities and sub-communities impacted disproportionately by the pandemic from a health perspective, from a workplace perspective. You know, we may have workplace health solutions that were designed to focus on one population and not nearly as diverse or as equitable as others. You know, everybody needs a personalized and tailored approach from a slightly different perspective. And so having these elements in play for our health programming from all perspectives will definitely be something that we're going to see a lot more of in 2022, simply because it's time to do this. We can realize significant gains and significant improvements in our approaches and, of course, outcomes down the line when we do foster a type of working environment from a health perspective that is far more inclusive. Now, I put this up because this is a very interesting summary, if you will, of the concept of equality, equity, justice, inclusion, and all those underpinning aspects. So you can see the continuum around, how we address people from a health perspective, and the equality, equal access, really doesn't solve the problems, right? And when you tailor and approach support from a different way, you tend to get better outcomes. And when you address the issues at the root cause, well, then you do actually get better bang for the buck there. So, a challenge to a lot of folks in the workplace health space is to start thinking about these things a little bit more differently and figure out new and better ways of doing things, because that is going to be quite meaningful to workplace health programming as we move into 2022 and beyond. Now, from a financial health perspective, this is something that is quite high on the list that employers are talking about these days in order to best support their people. And really, it's not just about financial literacy. It's not just about the providing information to people. We have a serious skills gap when it comes to how to budget, how to help people in terms of managing their own finances and saving for their future and their family's future. Now, these are key sources of stress and key sources of interpersonal conflict for those in relationships. The talking about finances and money is difficult. And we know that, this is something that we've seen over the past 10 years be steadily and increasingly included in approaches to workplace health. And this is something that absolutely does need to continue here in the near term. So a lot of employers are looking for support for their employees in this sense as well. Now, it's really beyond that information piece. As I mentioned, it is about education, and it's about training, it's about getting that skill set. I was recently reading about some improved high school programming and college level programming to really teach people financial management, budgeting, all these sorts of things that we do. In fact, I remember giving a talk for one of the healthcare organizations that I was a part of on equating your approach to health being the same way that you approach your finances, and that there should be planful and meaningful understanding of the things that you do to improve your own health at the same time as you improve your financial health and well-being, which is exceptionally important. So we're seeing an awful lot of employers quite focused in on this these days and really helping to support their people. We have so much uncertainty coming up in the near term here, and in fact the long term, that you may not necessarily have the safety nets required. So anything you can do to build that out and help support people will be a much better workplace to be a part of. Now, next up is the concept of leveraging data and using information and evidence-informed strategies to improve our approaches to workplace health. Having information isn't necessarily the end goal, but it is part of that decision-making process. So we can move from the state of collecting information, yielding some knowledge, perhaps getting some insight, and then hopefully moving towards results and actually action tied into that. And so, we continue to see employers asking for evidence-informed strategies, for improvements on data, for improvements on reporting, and everybody in the space is looking to get a better handle as to what's functioning and what's not functioning. You do need very strong data in order to get to that point. And the focus in on outcomes is absolutely critical to this. You think about this drive from a workplace perspective, moving away from hourly-based pay into outcome-based pay for those on salary. So the outcome is really the productivity and performance, and less so about having somebody available at the computer monitor between 9 and 5, particularly if it's a distributed workforce and they're working from home. So this shift towards having an outcome-driven approach to workplace health makes a heck of a lot of sense. And unfortunately, we're not set up in many respects to really deliver that with good quality data and good quality tracking, and of course integrated in from a complete health perspective. So this is definitely something that we see organizations focused in on here in the near term, simply because the technology is available, the data are available. We just have to put it all in the right spot and make sure sure that it is fully actionable for employers to leverage and best help their people and best support their people as we go forward. So with that being said, I realize, this is a short amount of time to cover, 5 key measures that we're looking at occurring, and 5 key things over the course of 2022. To reiterate, COVID-19 not going to go away. Everybody hoped at the end of 2020 that 2021 would be better. Not necessarily the case. So it's going to continue to shape our approach to the workplace. And health and productivity solutions. So, return to offices and those sort of things, and living with that COVID risk needs to be something that we consider in our approaches. Same thing on the brain health side. It's not just about COVID, it's a little bit beyond that. We do have significant mental health challenges on the horizon. And we do know that based upon our collective experiences in a variety of different situations, that the true impact from a brain health perspective occurs much after the resumption of normalcies, if you will. So if you look at people impacted by floods or fires or those sort of things, during the moment, in the heat of the moment, they tend to fare pretty well. It's in the aftermath, in the months and years later on, that you do see an increase in the need for these types of services. So the challenge here is to make sure that people don't remove any of these types of supports too soon. Now, diversity, equity, and inclusion, a question I like to ask is does your approach to employee health and employee wellness program stack up? Does it meet the tests around diversity, equity, and inclusion? Do people feel comfortable seeking assistance and looking for help in this sense? Or is it personalized to their personal journey? Which is a really good question to ask of your current approach to workplace health. Financial health, from my perspective, it's not just about literacy here. We have to provide skill sets and training and support for people to really bring them to that next level. Absolutely crucial as we move into 2022 and beyond. And of course, to round things out, the data-driven decision-making, drive engagement in health and really drive outcomes from this perspective, and make sure that technology is a key portion of that, particularly for those organizations with distributed workforces. So we realize, there's a lot of other things going on right now, lots of change. We tried to distill it down to the 5 main ones, and of course the subcategories therein. But hopefully, this will provide you with some foundational work, if you will, as you look to retool and improve your approach to benefits and your health strategies as we move into 2022. Now, from a crystal ball perspective, 2022 may be as difficult as we had in 2021. People are going to continue to need support, and employee well-being and health should be a priority for everyone. And we do believe we've got high engagement, and we want to continue to drive that as we move forward here, because there are some great solutions available to employers, and we're just happy to have the solutions that we have, and we want to continue to measure and address them from a strategic perspective. So with that being said, I'll turn it back over to Daryl. Thank you for your attention. I realize it's a lot of information to absorb in a short period of time. We do have a white paper that highlights some of the research on the back end with regards to these, and more than happy to entertain any questions should you have any.
Excellent. Thank you, Tyler. So one of the questions that came up was regarding the white paper. And yes, it is available on our website. But if there were any resources that you would recommend to people that they could go out if they wanted to learn more, are there certain resources you feel would be most valuable?
A really good question. Obviously, Daryl and I have made an awful lot of content and educational material available throughout the course of this year, which of course lays the foundation for some of these things. National Wellness Institute has a tremendous amount of resources as well, a lot of it peer-reviewed, and ensuring that it is good quality information. That's always a key. I'm quite leery of what's called gray literature out there, to make sure that you're not using any poor sources to inform your strategy. And so that's a really good example of another source of this type of information. General approaches to human resources, they tend not to be very much focused on the health stuff, but in some organizations and solution bases, you actually can find some quite good information there. And then, of course, there's the literature base around, perhaps the American Journal of Health Promotion, which does have some pretty solid research there that I alluded to before. And that's just one example of a whole myriad of peer-reviewed publications that have good quality information that you can base your strategy on.
Excellent. Thank you, Tyler. Well, and it's always interesting reading a white paper, but when you hear it being walking through it in a session like this, it's sometimes that much more easier. So Dr. Tyler Amell, I want to thank you for your time, and for everyone that's joined us, thank you too. Of course, our last session for 2021, we will see everybody back in 2022. Thank you for your time. All the information will be up on our website, and have a great day.
Everyone, take care, stay safe.